Psychology counseling exam brief, 6 months. Those who are appearing for August exam. Those who enrolled before April. 22nd to 31st August exam window. All MCQs, all the questions will be from Psychology Counseling book. This book has almost all conditions, and for every condition, there are 20 to 50 tips how to manage those conditions. A conversation. For every condition, there is a conversation in this book, how a conversation between counselor and client goes on. What are the common questions a client will ask, and what are the good answers a counselor should give? These things are there. Fourth thing is also additional there, medicines and side effect. This fourth thing, medicines and side effect, you can skip for exam. Medicine side effect will not be asked, percentage, how many percentage they, this condition and all, that will not be asked. Exam will be easy. All the questions for psychology counseling 6 months program will be from this single book. All will be MCQ. 50 questions, 60 minutes, no negative marks, 1 hour, exam window 22nd to 31st August. Exam link will work only one time. For child exam, you will have 50 questions, MCQ, 60 minutes, no negative marks. Exam link will work one time. 35 questions will be from the child book and 15 questions will be from this book, right? If you do not read this book, it is very less likely to pass because the child book is tricky. The questions from child book, all are going to be the scenario-based questions, case study, scenario-based questions. Sometimes what mistake students do is that they apply their own upbringing, their background, their understanding, how they have raised their children, how they have been raised by their own parents, and they try to answer according to them understanding. Wrong answer. Whatever is in the book is the scientific answer, and we will consider that as the correct answer. Okay, and it is the correct answer. Psychologically, scientifically, counselingly. Now, how to read? Okay, we'll cover the fellowship part also. Should we do that? Okay, fellowship student, they have 2 exams. First exam, in the first exam window for them is child exam. Exactly same pattern as the child. Okay, 50 questions, 1 hour, all MCQs, 35 questions from child book, 15 questions from psychology counseling book. The second exam, if you have completed your fellowship first exam in the previous Feb 2022 window, you will have your second exam of fellowship, right, in August. For that, you will read this in detail. It will be open book exam, which means that it is going to be little difficult without reading. Okay, open book exam is always difficult, right? For fellowship final exam, means fellowship second exam, you have 2 exams. Single email you will get. In that email, there will be 2 links. One link, you can click multiple times and download the theory paper. So within 5 days of getting the link, you click on the link of theory paper. There is one link on theory, second link on MCQ. MCQ link will work only one time. You cannot click it twice. One time you click on the, again. So the theory exam, within 5 days, you click on the theory exam link, download the paper, Word file, write your name, mobile, email, all those things very beautifully. Then start writing your answers by typing on the Word file on your computer. Take 3 days, 5 days. There is no time limit for theory exam, right? Before the exam window is closed, 31st August, and before you appear MCQ, you submit your theory on the same email. And when you submit it, remember to attach the file. Sometimes you tend to forget the file, then your exam window shifts to February. Very good, congrats. It is called legends, okay? Sometimes you attach your file, but the file does not mention your name. Very good. Super legend, ultra legend. So we don't know who he is. Okay. So even if the file comes from your email ID, we will assume that this is non-submission. Okay. So make in the file, there is an option for entering your name, mobile, all those things. So make sure you enter that. Theory plus MCQ exam is only for final exam of fellowship students, not for other subjects. Okay. Make sure you submit your theory paper first, and then only you click on the MCQ link and appear the MCQ. MCQ link will have same format as Psych 6. All the questions will be from this. Most will be scenario based. So you have to read. Okay, you have to read properly. And 50 questions, no negative marks, 1 hour. Link will work only one time for MCQ. So for fellowship students, first exam is always child exam. Okay. Okay. For child exam, I will repeat. For child exam, for child counseling course, as well as first exam of fellowship, 50 questions, no negative marks, 60 minutes. Link will work only one time. 35 questions will come from the child book and 15 questions will come from this book. Clear? Okay. Now, how to read the book? Okay. How to read psychology counseling book, right? Irrespective of the course which you have taken, except marriage counseling, obviously. Psych. I will answer that separately on WhatsApp, my dear, or you can call me tomorrow. I will explain for you. Psychology, see, if you have taken Psych 6, then you will have only one book. For psychology counseling 6 months program, there is only one book. This book covers counseling as well as psychology, both aspects, right? For child, and you will have 2 books, this plus child, right? For child book, you will read the whole book. Okay. Question can come from anywhere, right? It's already small, right? Don't worry so much. So typical questions for child exam are child exam questions. You are a school counselor and a teacher comes to you saying that one of the students from the class, she was very much interested for drama, play in the drama, role in a drama, but she did not prepare her lines. She was given 2 days again to prepare again and come back, but still she did not do. Now the teacher is asking, how do I manage this child without traumatizing psychologically? Earlier, I used to scold the child, hey, come on, you are not prepared and all those things, right? But I was not a good teacher. Now, since you are an NSA certified school counselor, I know you are very good in explaining and managing the child without traumatizing psychologically. So can you make me a good teacher? What should I do? So the options is, okay, go scold the child. Option 3, give one more chance. Option 2, okay, option 3, I was checking you whether you are awake or sleeping. Option 3 is don't give the chance to the child and tell the child, I already gave you one chance. Now you should understand, you didn't do your part, you didn't do your assignment. Now you get to work for next drama. Not for this. I'm replacing you. Okay. And number 4 is something else. Okay. So the correct answer is number 3, because you gave the chance to the child. The child should understand, not every time you are going to get rewarded. You are not working in a Hindi movie where even if you are the worst drama player or you sing the worst thing, or you do not sing, you go on the stage and stand, you get the first award. It works in only Hindi movie. Real life does not work like that. If you perform best, you get a first reward. There are other students who are waiting for drama. I gave you the chance, you didn't prepare well. Now your chance is gone. The other child will get the chance. Okay. You should have prepared if you are really interested. You didn't prepare, you have put certain other priorities. It clearly means that you are not committed for this. Okay. No worry. I will give you the second chance, second time. This time your chance is gone because I already give you two chances, my dear. And the child knows that good behavior is rewarded and the lack of certain required behavior is not rewarded. There are other children in the line. There is a competition. It's not a Hindi movie. Another example. Child comes home disappointed and scored third rank in the class. Okay. So if you are a parent who has been coached by an SCA school counselor or parent counselor or child counselor, right? How will you manage this scenario? Option one, you say, okay, no problem, it's okay. Option three, you are dumb. You cannot do anything. My mother used to give me good scoldings and beatings if I get third rank. You must get first rank. Otherwise, you will become nothing. Okay. Number three, you tried. You scored third rank. Next time, do well. Try to score first rank. Number fourth, start beating the child. Don't spare the rod. Okay. What is your choice? Number three, very good. Correct? Everyone, three. So why? Here, you are not accepting, you are not pushing, you are not disappointed. You say, it's okay. You tried, right? You tried. We are appreciating you tried, but it could not happen because there were some factors, either your factor, other factors. Next time, you do it better, right? I'm with you. I will support you. What help you need? Tell me. Which subject is weak, right? If you call me and come up with certain solution, you as my students, okay, right? NSC students, all of you, either you belong to management course, nutrition course, or psychology course. Have you seen that I do the exact same thing, right? You come up with certain thing that, okay, sir, I'm managing this client. What should I do, right? So what will I say? Yeah, you have prepared, you have attended the webinars, read the book, and do what you have learned. If you want to know more, Google, right? Learn more, right? And you should not hesitate. But take up that client because that client will add to your learning, right? If obviously it is a completely difficult client and medical legal issue is there, you should not take. But all other clients you should take so that it gives you confidence, right? It enhances your knowledge. If you do some research, read more book, do Google. Don't look for spoon feeding, right? So those who come for spoon feeding to me, I always ask them to manufacture the spoon and cook a good food and then eat yourself. Another question. So you got the idea, right? What kind of questions, scenario-based questions are asked, right? Now, how to read book, right? Psychology counseling. In psychology counseling, you start with page 1. Okay, if you're reading it first time, those who are reading first time, main topics to be covered. Okay, for child course, every topic is main and important because the whole book is very good and important. Plus, from this book, you can focus on ADHD, autism, OCD, generalized anxiety disorder, minor depression, and some childhood conditions, emotional conditions. Okay, you want psychology counseling questions? I will see that. Following are the symptoms of generalized anxiety disorder, except or all of the typical such questions have all of the above answer. Okay. Following are the symptoms for stress. You don't need to read the answers, right? You know what is answer. Such kind of questions, all of them. I'm not giving you answer here. So it can be other also. Panic disorder. A lady comes to you with these symptoms, what is a more likely diagnosis? Yeah. So options can be panic disorder, generalized anxiety disorder, stress, depression, or the OCD. Okay. Now a difficult level question. Okay. So 10 questions are difficult level to identify real outstanding student. If you score highest marks, you get the outstanding student award. Okay. Every batch we select. Difficult question level. A lady comes to you with palpitations, discomfort, trembling, shaking, sweating, all those things. And the diagnosis is panic disorder. You know it. Question mentions the diagnosis. It means this is going to be. What will you do? Right? So the question is open-ended, and the answer key options are also big answers, 3 line, 4 line. So you have to read and understand. It takes time and efforts. Okay. So it means this question is from complete chapter of panic disorder. Okay. The next question. What you should not say to this client. My God. This answer needs you to attend the webinar and read the book both. Okay. Another question. There is a child who presents with this symptom, and the diagnosis is autism spectrum disorder. So the question gives the diagnosis. It means this is difficult level question. Okay. So what you need is, so it will ask, the mother of this child comes to you and you are a child counselor certified by NSCA and you are very good. You are very well known in your city. What is your name? And if you speak your name, you become well known. You know? So the mother asks what she should say to the friends of her child. The children of her new apartment building, children of new school, what she should say so that her child gets accommodated with them and not get bullied, because the child has autism spectrum disorder. So in the book, there are 31. So even if you are a child student or a psychology student, so there are 31 tips. Okay. What a mother should say to the parents and friends of her child, so that our autism spectrum disorder child gets accepted by other peers. Right? A very important, and it is a real life thing. Okay, you will face this. ADHD. ADHD in adult, what are the common symptoms? Typical answer, all of the above. ADHD, you will do following. So it will give some solutions. So in the book, there are 20 to 50 tips to manage ADHD, anxiety, and all those things. Right? So if you see, majority of questions, they come from ADHD, anxiety disorder, OCD, depression, autism spectrum disorder, and all those things. Okay. Questions will not come from DSM and all. Theoretical, it will not ask, right? What is a percentage of population suffer this? Come on here. Who wants to know that? I don't care. Whenever the day I want to know that, I will go on Google and know that. Okay. So next time, if you go for interview and your principal asks you or anyone asks you what is the percentage of ADHD people, you say 1 minute, sir. You go check your mobile and Google and give the answer. Okay. Okay. Both na ADSD and ASD. What is this ADSD? Okay, probably same, something. Okay. Autism. Right? So there are treatments, you should focus on non-pharmacological management or a counseling management or counseling tips from this all chapters, right? Skip the medicines, skip the side effect. Those questions will not be asked, not required, not useful in your practice also. As a psychology counselor, psychologist, clinical psychologist also, they are not authorized to write any prescription, okay, or change any prescription, stop or start any medication, right? Even if someone is a PhD psychology or clinical psychology, they are not authorized to do that. Only a MD psychiatry, not even MBBS actually, technically. MBBS MD psychiatry, Doctor is allowed to write medications, remove medications, start medications, change medications. Bipolar disorder is another interesting chapter. Okay. Questions are asked from that. Then major depression, minor depression. Okay. So I will ask a very tricky question with no options for this one. Client comes to you, middle age, 40 years, single, and has this is the symptoms. All the symptoms of major depression: unable to get from the bed, not doing proper hygiene, and feels very heavyweight, not doing work, neglecting all the things. Okay. Well, how will you manage this client? This is a tricky question. If you think it's easy, 90% will fail. Okay, please write your answer. Everyone chat, write in the answer. How will you manage this client? The diagnosis, you are diagnosed that you think that, okay, that this client is a major depression. Oh, very good. You will advise the client to watch a movie. That is an interesting answer. Good. I like that answer. Very good. Okay. Okay. Any other question? Wrong, wrong, wrong. Wrong. Major depression client. We are talking of major depression. Huh? Ah, very good. Very good, Rashmi. Very good, Supriya. Correct answer. Refer to psychiatrist, Dr. Ketki, psychiatrist, not psychologist. Okay. So major depression, immediately you refer to psychiatrist. And internally, you will document. It is very important that you internally document this client came, and I think that this is a major depression patient, and I have recommended the client to visit psychiatrist or a hospital which has these services. Do not touch this client. Do not take the fees. Do not touch by telescope also. Okay. Okay, done. Okay, if you're reading this book first time, you will read this book from page 1. Read it like a novel, very fast. Skip the medicines, skip the side effects, and read in 20 days. Finish this book in 20 days. You may think that this is a 390 pages book. How can you complete in 20 days? Yes, it is possible if you read it like a novel. Do not try to remember. Do not memorize. Do not make notes. Do not underline. No worries. You will get confused with the symptoms. One symptom, multiple condition. One condition, multiple places. No problem. Read like a novel so that by the time you finish the first reading, you will get acquainted with the new terminologies, right? Don't stop for, okay, what is the meaning of this terminology? No, nothing. Because by the time you finish this first reading, you will get acquainted. You will find somewhere in the book, most of the terminologies, meanings, everything has been covered already. And you will get comfortable with the subject. When you read faster, you develop more interest. It excites you. Okay, it releases dopamine, right? It gives you reward. Wow, you've finished this big book. That is great, right? If you are finding whether this is your passion, reading this book fast and fast, it's the easiest way to do that, right? Second reading, when you start the second reading, that is a time you can make notes, underline, tick mark, open the dictionary, find the answer, attend more webinars to wait for some answers. There are some topics where I have mischievously, intentionally left it blank, okay, and written the statement, wait for the webinar to come. Okay, if you want to learn this technique, wait for the webinar. If you want to understand what is the complete story, wait for the webinar. To create your excitement, attend the webinars and learn, right? Second reading, you can go as low as you possible. Obviously, try to finish your second reading before your exam. Interesting question. Uh-huh. So the topics which I have told you, these are considered to be important. So typically bulimia, eating disorder, schizophrenia, they are less important. Bulimia, eating disorder, some questions may be asked, but less frequently. Okay, there are 2, 3 questions. Okay, a client comes to you, 18-year girl, she comes to you and she has this symptoms. She talks of this. What is the diagnosis? Or the difficult question will be, difficult version, her diagnosis is this. What will you do? Right? If the question gives you diagnosis, it means it is tricky. And if you answer this question, you more likely score highest marks and more likely you become outstanding student. Okay, important topics: generalized anxiety disorder, ADHD for adult, ADHD for child, ADHD for adolescent, autism spectrum disorder, OCD, bipolar disorder, minor depression, major depression. If you have missed it, you can revise this video again and watch it again. Or read the first 200 pages of the book. Schizophrenia and all those questions are very less likely to be asked. If you see a patient already diagnosed with schizophrenia, already major depression, already suicidal, do not touch with the telescope also. Do not take that client and refer immediately to a psychiatrist or a mental facility where they have all those facilities to manage such client. Unless you want to do some medical legal adventure. Okay, don't do that. Not a good idea. I like this, Supriya. Very good, interesting question. So the question is difficult. So in a question, there are 4 options or sometimes 5 options. And out of that, you think that 2 options seem to be correct. But actually, one answer is correct. So in that scenario, whatever the book, the answer in the book, that is the correct answer. Not the answer assumed by you or from your upbringing or from Google. Okay. It will be there in the video. Good question, Supriya. Will we get half mark? No, you will not get half. You get 0 or you get 2. Because 100 marks now, right? 50 questions, 100 marks. Okay, I will repeat the important topics. Okay, that was very fast. I will repeat. Don't worry. I forgot what was I going to repeat. Very good. I was checking you. Very good. Whether you are still listening while traveling in your local train, I was checking you. Very good. So, important topics. Okay. Generalized anxiety disorder, stress. Stress is the most common psychological condition all over the world. Second common psychological, equally common psychological condition, especially after lockdown, is generalized anxiety disorder. ADHD, ADHD for adult, ADHD for child, ADHD for adolescent. All these 3 chapters are in the book, Psychology Counseling. And how to manage all these conditions from the counselor perspective. OCD, bipolar disorder, depression. In depression, minor depression, major depression. Autism, right? All related to autism spectrum disorder, right? Some questions might come from eating disorder. Questions on medicines, side effect, percentage will not come. Personality disorder, good question, Ranjit. I think 1 or 2 questions should be there. I have not seen the paper, I'm not aware, but yes. So I tell you, if you read these chapters twice, you will score 70% marks, 70 to 80% marks, 80%. Okay. If you read these chapters once, you will score 60%, just passing. Okay. So like 50%, 50, you will either fail or pass, you take a chance. And if you read the whole book, most likely you will score 90% marks. If you want to be outstanding student, if you want to score higher marks, because you care for marks, you like to feel good, right, by scoring more than 90%, then you will read the complete book twice. Because these are the important chapters, but questions are going to be asked from other chapters also, my dear. Or if now there are some students for child counseling, you may have, or marriage counseling, you may have confusion which book has more chapters. You can WhatsApp me the photo of the book. I will reply with that. But if you're already clear, please don't send that. Okay. So the child book, 35 questions, psychology counseling book, 15 questions. It's very simple actually. But still, if by mistake you have two books or something else, something, then you can WhatsApp me to check which book is more important. Good, Shika. Very good. All the questions are objective, which means MCQ. All the questions are MCQ pattern. 50 questions, MCQ, 1 hour online, can do from your mobile, laptop, iPad, computer, anything. As long as you have internet, you need a good internet. Okay. Exam link will work only one time. If you forward the mail, it will get deactivated. If you reply to the mail, there are some very talented students. They are like, we have 10,000 students in one batch. Come on here. For psychology, nutrition, management courses, and clinical courses. We are nursing clinical courses also. So everyone is appearing exam. Everyone gets the email link. There are some talented students who reply, thank you for the exam link. I will appear on this date. Come on, your link is already deactivated. So do not reply to the exam email. Do not forward it. Then there are some ultra super legends. Okay, I don't know whether this word exists, but these people exist. Okay, I'll tell you what they do. They get the exam link on one email ID. They have another email ID, which may be their own, their husband or their child. They want to appear from this because it is lucky or super. I don't know what is the reason. Okay, but they want to appear from this email ID. They will forward this mail to this email ID. Very good, very good. You have been disqualified for this window. Okay, so the exam link will get deactivated. Okay, so appear the exam link, log in into your correct Gmail, and appear the exam link from wherever you have got the email. Right? Then there are very sincere but confused students. They will have one email ID which they have enrolled, registered, they use often, and they will get the exam link on that email ID. On their mobile, they have logged in with different email ID or the second email ID. And they keep on saying, sir, I'm not getting the exam link. I'm not getting the exam link. Right? So because you are logged in from different email. So open the laptop, make sure you log in with your correct email ID, and then see whether the exam link has come. Wait for 22nd, 23rd before getting the link. By 23rd, everyone should get the link. If by mistake you do not get the link by 24th, then only you should inform us. Those who have April onwards admission, they are going to appear for February exam batch. Don't do the adventure of appearing in August. Right? Because after appearing exam, you no longer can attend the webinars. Your knowledge will be affected. Okay. So as soon as you complete the exams, you are removed from the webinar list. Okay, questions? You liked today's briefing? If I missed out certain points, you can ask the questions. Exam is easy if you are prepared. Do not worry if you are afraid. Make sure you appear the exam because you overcome your fear, right? But if you're not prepared, if you're not ready, don't worry. Appear in February. Even if you get the exam link in August, appear in February. There's no charge for shifting your exam window to February. But there is no option to upgrade your marks. If you score less marks, there is no option to upgrade. Remember this. Scenario-based questions will be from all the book. Whichever book you have, all the books. Okay. So out of total 50 questions, whichever you subject, out of total 50 questions, 30 questions will be okay, 50 questions, person will be scenario based and direct. Okay, it will come from whichever book have been told. If by mistake you have got 3 books for child, then you can WhatsApp me. I will tell you which book you should focus more. Who is this? Huh. Next, any question? Should we close? Exam window 22nd August to 31st August. Make sure you finish your exam by 31st August. Okay. If any technical difficulty on 31st August, then your exam window will be February. If any technical difficulty till 29th or 30th August, we will try to resolve it by 31st August. Correct. Questions will be from the books only. Outside questions are not there. If you read these books, you will learn good knowledge for your practice, for jobs, for managing your clients, as well as exam. Make sure you appear exam only one time. The link will work only one time. Remember this rule, link works only one time. Do not forward the mail. Do not reply to the mail. Appear. Okay. Exam is comfortable, right? If you are read it twice, then you will score good marks. If you are not read it, you are waiting for opening the book during exam, most likely you will fail because it will be difficult to find answer because the whole chapter becomes sometimes one question. Okay, each option will be from different pages. Especially for nutrition people, it is this. Okay. So one option is from one chapter for them, right? So nutrition people, they have to be very thorough. For psychology, at least one option is from one page. Okay, read